All right, everybody, we're going to wait just another minute or two to allow everyone else to get into the room so we can begin. So if you just bear with us for another moment, just want to make sure everyone has enough time to log in and get settled before we start. Okay, it looks like we're leveling out a little bit with people joining. So let's go ahead and get started. So welcome everybody, and thank you for joining today's EQIP Open Enrollment webinar for Performance Year 5. Most of you already know, but my name is Kim Dixon, and for those of you who don't know, I am the program manager for the EQIP program. We are going to walk through this year's enrollment process using the EQIP portal, or EAP. So whether you're returning participant or you're joining for the first time, we are here to ensure that you have everything that you need to successfully complete enrollment. Next slide. Perfect. So let's take a step back and start with an overall timeline for program year 5 enrollment. Between May and about the beginning of August, beginning to middle of August, new practices. This is the time frame that new practices will need to complete any CRISP onboarding that they need to do. Then from July through August is the time when the portal will be open for you all to enroll in the EQIP program. This year, open enrollment begins on Tuesday, July 1st, and will close on Friday, the 29th of August. If there's any questions about eligibility or the process that you need, please reach out to the EQIP inbox at equip@crisphealth.org. We'll be happy to assist you in whatever it is that you need. The enrollment process is probably about a 30-minute process, give or take. And we do have communications that we have and will be setting up for reminders for you all when the deadline will end. Then once enrollment is closed, CMS vetting and the contracting piece of the EQIP program will begin September through December. We do have a hard deadline of August 29th, and that is essential because we'll need that time to work through any eligibility issues, maybe tweaking some different care partners where needed for different entities. Maybe those are dropping, new ones coming on board, things like that. And then from there, we'll send the full and completed list of NPIs to CMS for CMS vetting. Once we get those results back from CMS, there's usually additional changes that have to happen to the rosters. And then we, again, go through another auditing process just to make sure we've dotted all our I's and crossed all of our T's. At that point, that's when we start the contracting process for the care partner arrangement. With that said, though, this year we are going to use an electronic version of the care partner arrangement. So I know a lot of you are going to be happy about that, but what is critical, it's vitally important, is that when you are uploading your MPI list, it's very important that we have the direct email address to the care partners so that we can email them their electronic version of the contract. Okay. And as you also, probably many of you who have already participated are aware, this process, the contracting process, can take the most amount of time because there's the whole contract you have to go through, and then there's getting all the signatures. And so sometimes we have to chase down providers and say, hey, don't forget, you have to sign. So that can be a bit time consuming to us. And just as a side note to that, making sure everyone is clearly aware, that the final determination of those care partners who can continue to or who can participate in program year 5 does depend on whether or not that contract has been signed. So if a care partner doesn't sign the contract, they won't be able to participate. So, and every care partner, whether you're already participating or not, will need to sign a new contract for program year 5. Okay. Next slide. All right. So let's talk about the enrollment process. We have two different processes, one for new entities and one for existing entities. The new entities are essentially required to be initiated by a lead care partner, which is any practitioner that is going to be participating in the EQIP entity. One of the main pillars of this program is that it is to be a very provider physician centric program. And that's why we need that first initiation to come from an actual provider practitioner. Once that practitioner indicates they want to join and create a new entity, they go through a process to gain access to the portal. And then there are several other steps that they have to do before they can delegate access to the portal to an administrative proxy. From there, an administrative proxy can finish the process of the application, or the care partner can complete the entire process. That's totally fine as well. The new entity needs to send us an email to start this entire process. You need to send us an email at equip@crisphealth.org, and then we will direct you on the next steps that you need to take to finish out this process. For existing entities currently participating in PY4, the approved administrative proxies and the lead care partners already and will already have access to the complete full enrollment process for PY5. Within the portal, certain information will carry over from program year 4 into program year 5, and this includes your MPI list, your contact information, your payment remission details, and then your current PY4 episodes. That said, you will need to make sure that you review all of the pre-populated information to make sure that it's accurate and that it reflects the PY5 participation goals. So, and additionally, make sure that you review and select any new PY5 episodes that you may want to participate in as well, because those won't be automatic. Those won't be selected for you. You'll have to go through and do that yourself. I also wanted to remind everyone that you must get into the program. You must apply to get into the program, even if you're already participating. You can't just say, well, I'm already participating, so I don't have to do anything. If you don't do anything, you won't get into the program for PY5. So everyone, new or existing, must apply. Okay. Do we have any questions on that part of the process so far? Excellent. I'll move forward. Next slide. All right. So for new entities, for brand new entities, there's a couple of different pathways for this. If your entity or your practice is completely new to CRISP, meaning you do not have an account or currently use CRISP right now, we need to work through an actual CRISP onboarding process with you. And this is so that you can participate in the State Health Information Exchange platform that we have that CRISP utilizes. And this process is a longer process than the actual EQIP application process, specifically because there is a participation agreement that needs to be signed, as well as setting up any kind of patient panels and other incidental items that have to be set up on the back end. We want to even if you have access to PDMP currently, that does not guarantee that you have access to all of the CRISP access, and so you will still need to have an onboarding process set up for you, and all of that stuff needs to be set up on the back end in order for you to gain access to the actual EQIP portal. If you already have an account with Chris, this may be a more simpler process in that we just need to get the lead care partner access to the EQIP portal, and then we take it, go from there, going through the application process. Either way, the best way to get started with all of this is for your entity to send us an email, again, at equip@chrishealth.org, so we can investigate on our end what actually needs to happen and then follow back up with you to take the next steps, whatever next steps that might be. Please, please, please keep in mind that all of this can take a couple of weeks to complete, and we will work very closely with you to make sure that all of this can be done as efficiently as possible. But if you are a new entity, you cannot wait until the last week of August to start this process, because you're not going to have enough time to get it done. So if you are a new entity and you are interested in applying or trying to join EQIP, please reach out to us before the middle of August so that there is enough time to complete all of these processes and give you the time you need to do the application as well. Okay? Once we have either of these onboarding scenarios completed, the lead care partner will be enrolled in EQIP, and then we'll get you credentialed into the portal. You will receive an activation code and password email that will need to get, you'll have to set all that up, and then there'll also be a two-factor authentication setup process as well. And the reason for this, as you know, Chris, we have a lot of data in Chris and in the portal, and we want to ensure that security is as tight as possible. And then once all that is complete, then we can lead into the next steps for the new lead care partner. Okay, next slide. So the lead care partner will then be required to type in their own information, first name, last name, and email. The biggest item here is that they will need to designate if they're going to be participating as a single practitioner, a single MPI, or if they're going to have multiple MPIs participating in that entity. Because that prompts two different types of screens in the portal. So if you're individual, there's going to be a certain screen, but if you are having multiple care partners, that'll have a different screen that'll show up in the portal. Once that step is completed, then the lead care partner will be required to give the EQIP entity a name. It's a free text field, but keep in mind, this is how you are going to be identified throughout this program. So whatever name you choose, make sure it's something that you're comfortable with being identified as. You can also use like your practice name and then maybe have a subset. For instance, if you have multiple different specialties that you're going to be participating in, you could use your practice name and then dash specialty, whatever that is, cardiology, ortho, GI, etc. And then finally, this is where the lead care partner can decide if they want to do enrollment from start to finish or if they want to add in an administrative proxy to finish the process. If you add in an administrative proxy, you'll need to input their contact information, and you need to have at least one administrative proxy. And then the administrative proxy can then pick up right where the lead care partner left off. If you're not already in CRISP, but it's very important first step, and it all has to be done by the lead care partner. Okay, any questions so far on what I've talked about? Awesome. At this point, I'm going to hand it over to Crystal to talk through.
One question.
We do? Okay.
Nina asked, given that contracts will now be distributed directly to participating providers, will the portal be refreshed often with signature status so proxies can ensure they follow up with providers who have not signed?
I'm sorry, Crystal. I think my internet may be lagging. You broke up. I didn't hear the full question. I'm
No
sorry.
worries. She just asked, given that contracts will now be distributed directly to participating providers, will the portal be refreshed often with signature status so proxies can ensure they follow up with providers who have not signed.
That's a good question, Anina. And I'm I'm going to have to tell you, not all of that has been completely ironed out on our end yet, but we will get it ironed out. And one way or the other, whether it is via email or via the portal, you will be notified if we need help, getting signatures signed and or who has already signed. Does that answer your question? I hope.
Yeah, I think
Place it in the chat. Did that answer her question?
yeah, I think the answer is close, so she's good, I think.
Okay, perfect. All right. And if you have more questions or you need to talk this through any further, just shoot us an email, and we'll be happy to reach out to you. All right, I'm turning it over to Crystal. Crystal, you can walk through the next couple of steps.
Awesome. Hi, everyone. So I'm going to quickly go over the EQIP entity portal migrating to the CRIS portal. I'm sure, as some of you have heard, all EQIP users will be accessing EAP through the CRIS portal for PY5 enrollment and just moving forward in general. Our log once system is coming to a close, so we will be accessing everything through the CRIS portal. So it is super important for all active administrative proxies as well as lead care partners to activate their CRIS portal accounts. The migration occurred, I believe, on June 10th, so you should have received an email that included activation instructions from do not reply at hmetrics.com, and that kind of explained everything that you would need to do to activate your CRIS portal account. If by chance you did follow those steps and you still are having issues, you can feel free to reach out to us at equip@crisphealth.org. But I do just want to note that this will be the only method to access the ePortal moving forward after July 1st. So it's extremely necessary that you activate your account prior to the enrollment period and just in general so that you can stay in the loop with all things related to EQIP and especially with your specific entity. And then you can go to the next slide, Kevin. And so this is the email you should have received. I believe there was one sent out this morning at 8 a.m. if you maybe perhaps missed the first one. So here it kind of dictates all of the information that you will need if you're setting up a new CRIS portal account. This is especially important for users who have never used the actual CRIS portal and have only been using Log Once to access the ePortal. So you will need to go in and create your whole account. And I do want to also note that the CRIS portal account registration link, so that initial email that was sent on June 10th, is only eligible for 72 hours. So the link that was sent to you is likely expired by now. So if you did receive that email and perhaps you missed that window, you can request a new activation link, and then you'll be doing so through contacting either your HIE admin for your organization and also contacting CRISP technical user support. If you do need assistance in finding out who your HIE admin is, feel free to reach out to equip@crisphealth.org, and we can find out who your HIE admin is and also loop you in with our technical user support. But after you've activated your account, you should be able to access CRS through the CRIS portal, and that'll be everything that we would need you all to do on your end. And is there any questions perhaps about the migration? I see there's some other questions in the chat, and I will go through those as well. But if you have any questions related to the migration as well, please feel free to put that in the chat. But while we're waiting for those to come in, Kim, we do have a couple of questions here. The
Okay.
first one is from Matthew Dunning. He's asking, if the administrative proxy contact leaves the organization, how would we notify CRISP of a replacement?
You can, Crystal, they do have access to change that themselves, don't
Yes.
they? Yeah.
So Matthew, on your end, once you go into the CRISP portal, if your administrative proxy no longer works at your organization or no longer cares to act as an administrative proxy, you can delete them on in the portal, and we will get a notification that says Matthew Dunning has removed whoever as the administrative proxy. And you also have the ability to go in and add administrative proxies directly through the portal. Now, if this is somebody who is brand new to your organization, once you add them, we'll get a notification, and then we would go in and make an account for them so that they would be able to access the EAT portal. And we would basically just give them, or now with this new process, you would essentially add them you would provide them with a portal account using your login. If you're acting as the HIE admin for your organization, which you may or may not, that person would go in and add this new administrative proxy with a portal account, and then we would go in on our back end and provision them with the EQIP configurations, and then they would be able to act as that replacement. If that makes sense, please let me know if you need any other further clarification for that. Okay, awesome. And then Kim, Gina is asking, will it go to each provider directly or can we have it sent to one? I think this is in reference to the
To the
CPAs.
contracting. So it is my understanding that the way this is going to be set up is that it'll go to each of the actual individual NPIs, which is why we need their direct email address. But we can also, I'm assuming we can probably compile all of the NPIs that have been sent to your EQIP entity into a list and send that to someone on the administrative side if that is necessary.
Awesome. And the next question is from Jesse Pines. He's asking, can we choose the baseline year of 2022 for the emergency medicine EQIP program? If so, how do we do that?
So for emergency medicine, you are going to automatically be using the baseline year of, and I believe it's
22.
it is 2022. I thought it was 2023.
One of the two. I believe it's 2022, but I could be wrong.
Regardless, it will be an automatic thing for you. You do not have to choose. It is only for ED this year. It's kind of going to be a pilot to see how that works. Unfortunately, we were not able to equate the numbers well enough to make it across the board change this year, but we are hoping that we have a successful year with the ED at 2022, 2023. And I'm pretty sure it's 23. And then we'll move forward with having discussions this year, moving into next year for next year to up the baseline year. So in essence, Jesse Pines, you do not have to do anything. It's going to be automatic for you.
Okay, and our last question is, if I have access to the CRISP portal but will need access to EQIP, when can I request access and where can I find the steps for this process? So if you do already have access to the CRISP portal, I'm pretty sure, well, as a follow-up question, do you currently have access to the e-portal as well? Or are you looking to join the EQIP program this year? And you can feel free to just put that in the chat. But if you already have access to the e-portal, and you're already a participant of EQIP, then you should already have, okay, or has previously enrolled in EQIP, but I'm new on the team. Okay, that makes sense. So since you're technically a new person, we would need the HIE admin for your organization, depending on what that is, to essentially create a portal account for you, and they'll be able to do this. We can give them the kind of the user guide on how to do that. And then once that is completed, you'd be able to access your portal account, and then Kim or I can go in on the back end and provide you with access to EQIP, and then you would be able to access the reports tile, and it would loop you in. And that is if you're acting as an administrative proxy. So your organization would also have to add you as an administrative proxy within the e-portal in order for you to be able to access any data or the enrollment application. So I hope that answers your question. And feel free if you would like to email us with your organization and any other further questions you may have, and I can kind of help you make sure you have the access come July 1. Okay, perfect. I don't see any other questions, Kim, so you can feel free to.
Awesome. All right. Kevin, you can go to the next slide, please. All right. So as Crystal stated, we are accessing the EQIP portal through the CRISP HIE portal. And so that's a new URL that you will need to bookmarks, right? So that is listed right up here, the idp.crisphealth.org. That is the URL to reach the CRISP portal. It is linked here, so when you do get when the slide deck does get sent out to you, you can easily just select it. And please make sure to bookmark that site so you don't lose it. Because again, this is the only way you're going to be able to access the EQIP portal. Once you access the EQIP portal, or once you access the CRISP portal, I'm sorry, you will see the reports tile. You see the arrow here on this screen. You will see that reports tile. That is where you need to go to select to get to the CRISP reports landing page. And then you can, once you're at the CRISP reports landing page, as you see on this screen, you will see the Medicare population tile. So you select that. And then from there, you'll see on the second screenshot here, you will select the EQIP enrollment portal. If you are an existing entity, everything else from this point looks exactly the same. But from this point forward, I'm going to go ahead, Kevin, you can stop sharing your screen. I'm going to go ahead and log into the portal. I'm going to log into the demo site so you all can see what it's going to look like. Give me just one moment while I go through my two-factor authentication and get in. And then I'm going to share the screen. Okay, and share. Okay, so again, we are now at the CRISP reports landing page. We're going to hit Medicare population, and you're going to scroll until you see the EQIP enrollment portal. Now, your screen may look a little different based upon however many other reports you have access to. Just make sure you're selecting the CRISP the EQIP enrollment portal. So we're going to select that. Okay. So from this, it might be taking a little extra longer because I'm sharing the screen. There we go. Okay. So from this point forward, I'm going to walk through this process as if you are a brand new entity. You're not already participating in EQIP. You will come to this screen and you will see that the program period 5, calendar year 2026. And you will see here next to the EQIP entity, you will see unenrolled. That means you're brand new. We're starting from scratch here. So we're going to want to select the start enrollment process. And this is where you are going to fill in all of your information as the lead care partner. Okay, so remember, the lead care partner has to initiate everything first. Okay, so as the lead care partner, we're going to, first name is Tom, contact last name is Noah. I'm going to fill all this in, putting in the email address. And then we're going to put in the phone number. And then we're going to pick, okay, there we go. This last step right here, are you enrolling as an individual care partner or multiple care partners? So if you are the sole NPI that is going to participate in this entity, then you would select this drop down and you would say individual care partner. If you are going to have even just another NPI that will be participating in the entity, you're going to want to select multiple care partners. Either one of these that you select will give you a different screen when it comes to further on down into this application process. So make sure that you're selecting the correct selection here. So we're going to go with multiple care partners because we're going to have more than just one person who is participating. Always select save after every screen. And then we're going to go next. Okay. This is where you're going to name your entity. Okay. So we're going to call this, we're just going to call this Okay. From here, you download this submission template. This is for your MPIs. Make sure that you use this specific template, because if you don't, it's probably not going to accept the Excel spreadsheet that you're sending in. You want to download the submission template, and it's going to look like this. Crystal, can you see the Excel spreadsheet here on my screen?
Yep, I can see it.
Okay, perfect. Okay. Then you're going to type in the MPI, the first and last name, the email address. Now, there's a couple of changes if you're an existing entity to this care partner spreadsheet. We want the actual practice name that they're coming from. So if you are a practice or an entity that's maybe having multiple practices that are participating under one entity, we need the name of the practice that they're coming from, and then we need their practice address. And then from there, we'll need the billing address for where the billing information and whatnot goes to. So if it's a central entity that just houses multiple different practices, it would be the central address that goes there. And then also listing out what specialty that those doctors or those NPIs are actually participating with. Once you have that, you can then turn around and upload the list into here, if it's going to work. It doesn't seem to be working. Alan?
Yeah, do you want to scroll down? I see that bar on the side that popped up.
There it is. Sorry.
Okay.
All right. So then you would choose the file that you're going to put in, and it just automatically uploads it for you. Again, it may take a minute. There we go. So now it's uploaded. File successfully uploaded. Okay. Okay, so this is important here. So an NPI can only participate in one entity. So if you have, by some chance, an NPI that is actually participating in a different entity, then it'll tell you. And so then you're going to have to go through and find out which of these are actually participating. If you need help with that, please feel free to reach out to us at EQIP@crisphealth.org, and we can help you get that sorted out. Again, you'll have to save. So I guess since this is already, I guess it's going to take it. Let's see what happens if we hit next. Okay, it took it. If you get that error, please make sure that you go through your list with a fine-tooth comb and make sure that they are not, the NPIs listed in there are not actually participating with a different entity within EQIP. Okay, moving forward. This is where you then fill out for the administrative proxy. So if the lead care partner wants to add the administrative proxy, and I guess I probably should back up just a little bit. This entity information, you definitely need to fill out the name. You do not necessarily have to upload the care partner list at that point if you want the administrative proxy to fill out the rest of the application. I did that process because I just wanted you to see what it looked like. Once you have the entity name, you would then come to the administrative proxy tab here, and then you would add the administrative proxy. So the question here says, do you want to allow an administrative entity access to review, submit, and manage data on your behalf? If so, you say yes. And then you can add the administrative proxy here. You would just need information. So you could put in test. And then you would need an email address. And then you could put in whatever organization affiliation that the person is with. So let's just, and then we're going to hit save. Okay. So at this point, you can hit save and continue, and it'll take you right back out to the to this process. From this point forward, the administrative proxy can then come in and find your EQIP entity name that you'll see right here at the top, and then continue where you left off. So, or as the lead care partner, you are also able to complete this process completely by yourself as well. So we've already filled out the care partner list here. We have the administrative proxy here. Then we would slip down here to episode intervention. And this is where you're going to go through all of the different episodes that are available. So these are all episodes available, whether you are eligible or ineligible to participate in. And you would go through and select the ones that you would like to participate in. So let's see, we've got, I don't see too, here we go. We've got an eligible one here. So orthopedics here. So in here we have more than 11. So we know that we can participate in this. Do we want to participate? You have to double click and then you would say yes or no. Okay, so we're going to say yes, but we also need to fill in for our interventions here. This has to be done. You have to participate in at least one. You can do all three if you want, but you have to do at least one. So for this, you can, let's see, let's do care coordination and transition. We'll choose that one. As a note up here, this link up here, intervention examples, this gives you an idea, an overview of what these are: clinical care redesign, beneficiary, caregiver engagement, and care coordination, in case you need to sort of brush up on that sort of thing. Okay. So from here, we're just going to say, yes, this is what we want to participate in. And it updates accordingly. Okay, Alan, I'm not sure why it's doing this. It's saying
Yeah, I
that
think
clinical care.
you just have to select no for that. It doesn't default right now, but I'll make a note of that.
I'm sorry. Okay. All right. So here we go. So update. There you are. That's on me. That's not the program's fault. If I remember correctly, that's how it worked last year as well. So just make sure you select yes or no for either any of those, and then you hit update and it automatically updates for you. Okay. Then you can go through and try to see if there's any others that you want to participate in. If you don't, that's fine. One's okay. The more you participate in, great. And if one is all you want, then that's good as well.
I do have a couple questions in the chat.
Yep.
The first one came from Charlotte Mars. She's asking, lead care partner, if we have multiple providers and are enrolling in two of the EQIP programs or two enrollment categories, I think, example, GI and cardiology, can our president MD be the lead if the president is not GI or a cardiology provider? So essentially, can the lead care partner not be a specialty physician within the specialty they're enrolling in?
Well, I guess the question should really be, are they going to be participating in the EQIP program? Because it's my understanding that they need to be a participating person.
Yes, that is true.
So unless they're participating, I would say no. You would want to find a lead care partner who is actually going to be participating in the actual entity itself.
Yeah, and also to note, the lead care partner, they can only be a lead care partner for one entity. So if there are
Right.
two different entities, even if they're the same organization, there can only be one. And a lead care partner doesn't necessarily have to be a higher level authority at your organization. It just needs to be one person who's also participating and a doctor you would entrust to have access to the portal. Um, yes. And the next question is, what if the provider treats in multiple locations?
I guess I'm not sure I'm following the question. I guess I have another question for you. Again, an MPI can only participate in one entity. So if that entity is covering multiple locations, I think that that's probably okay.
Yeah.
But if that entity, like, so in other words, if you have a location in Baltimore, but then you have a separate entity location in Columbia, right? That MPI cannot participate in both of those. You have to choose one.
So yeah, EQIP essentially the location of where they specifically practice isn't that pertinent since it's
Right.
all claims based. So it'll associate all the it'll collect all the claims regardless of where they are as long as they're within the state of Maryland. So if they treat at multiple locations, if they're within, let's say for example, the GI, if they're a GI doctor, they're treating GI cases, whether that's at a hospital in Baltimore or a hospital in Prince George's County, it'll still all count. So I hope that answers the question. And then the last question that we got, is there a way to sort the episode group slash category so we don't have to scroll through everything?
Yes. So you can come here into you can select um, columns. You should be able to sort it out however you want to, so you don't have to, so you're not having to scroll through everything. If you want to, you can, well, let's see. It looks like you can choose eligible. That might be a way to go by choosing eligible. Um, yeah, so you have the ability to select which columns you want to actually be showing. If you don't want to scroll through everything, you might want to just select the ones that you're eligible for, and that might help narrow things down for you.
Yeah, I don't think there's a direct way to filter essentially what you see. You would only be taking the columns away, but you'll unfortunately have to kind of scroll and just see which ones your entity would be eligible to participate in.
Correct. Okay.
And I
Any
think
other
that's
questions?
the last question for now, Kim, so you can continue.
Okay. So then we're gonna save that button right there. And as you can see down here, the total volume of selected episodes now shows as 22. That is, that's updating that we have actually chosen 22 episodes, well, not 22 episodes, an episode that includes 22 baseline volume. Okay, moving on, we can select next. And from there, we're going to come into the payment remissions recipient. So this is important for you to make sure that you fill out in full because this process it gets pulled into the CPA arrange or the care partner arrangement. And it essentially says that all of the MPIs in this entity are agreeing that their performance will be cumulative within the entity and that the entity will then receive a lump sum check to this specific payment location and payment recipient. It's important that you fill out all of this information for the payment recipient who can sign the check, who is eligible to sign the check. And make sure that you go through this process here. So and then we're gonna do, here we go, test drive. Why does it do that?
I do just want to note the person or the organization that you put as the recipient, they should be eligible to sign the W-2 for the payment remission, not just the actual check.
And then the person who is the authorized signatory, so and then their email. Okay. And their phone number. And then you hit save. Okay, the data is saved. Then you come to the finalized page, so you can hit next. And it is highly encouraged that you download a PDF of your actual enrollment data, so you can always refer back to it later on. This does not like submit your entry at this point in time. You can come back in here and change things around. You have until end of day, August 29th of this year to finish all of this. But after, I see, Alan, we're gonna have to change the date here. So instead of August 30th, it should say August 29th. So after August 29th, you will not be able to go in and make any other changes or any other changes or submit anything else from that point forward. Okay. Now, I'm gonna hit save and continue later, and then I'm gonna stop sharing my screen.
And we have one more question in the chat, Kim.
Uh-huh.
Anja is asking, have the episode definition summaries been released for the new episodes in PY5?
Say that one more time.
Have the episode definition summaries been released for the new episodes in PY5?
No, well, they're in the process of being done right now. We are working on the actual playbook right now. We hope to have that finished by the 27th of this month. And so that will then be emailed out to all of the current entities that we have, and it will also be listed on our EQIP website. Kevin, if you just give me just one moment, I need Alan to share his screen for just a second. Thank you. Any other questions, Crystal?
Nope, that's it.
Alan, if you could share your screen so I can show an existing entity.
Yeah, I am not familiar with Zoom, so I'm just looking for the correct button to share.
There should be a big screen share square down at the bottom. Hover your mouse down at the
Oh,
bottom.
there it is. I got it. Okay, great.
Yeah.
Okay, that should be up.
There we go. Perfect. Okay. If you're an existing entity, okay, this is what your portal is going to look like. You want to make sure it says PY5 calendar year 2026 at the top. And then you want to come over here to this drop down box where it says EQIP entity and select the correct entity that you are looking for. Each entity, so if you have multiple entities under your purview, you are going to need to apply for each entity, okay? You can't just do one and think that all of them are going to be in. So every time every entity that you have listed under here, you're going to need to go in and do this exact process. Again, since you're existing, a lot of the information is going to carry over. Alan, if you could go ahead and just select the first one.
Mhm.
Yep. And then go to the start enrollment process. Just really quick. As you can see, everything's carrying over. You want to go through this with a fine tooth comb and make sure that everything on here is exactly correct. Thank you. You can pull down the list of your MPIs here. you want to make sure if you don't have an administrative proxy and you want one, you add. And then here you have the episodes and the interventions. Again, you want to make sure that you're selecting all of the ones you want to participate in, including the new ones for PY5. And again, for the payment remissions page, it's the same thing. Please make sure that all of this information is in here is correct, and that the person listed here is the authorized person for the W-9 and whoever can sign the check. Like that is what we need from you all. And again, finalized page, make sure you print out that page, and it will be open and available for you to change and edit until the 29th of August. Okay. All right, now you can stop sharing your screen. Any questions for the existing entities? Perfect. All right, Kevin, you can pull up your screen, please. All right, so we're just going to go real quick through the timeline. July 1st is the day that open enrollment happens for EQIP. Again, it closes on the 29th of August. We will have from September through December the whole CMS vetting and contracting process, and then a deadline of December 31st of this year, 2025, that all care partner arrangements must be signed and returned to us. That's a hard deadline because January 1 starts your new performance year, and we want to have everything tied up as neatly as possible. Before January 1st, if we can do that. So please make sure that all of your care partners get their CPAs returned back to us no later than December 31st. January 1 begins your performance year, and then usually about, I would say, mid to late January is when the PY5 preliminary target prices and the baseline data then becomes available in the EQIP portal. And then in quarter 3 for 20, that's when PY4 incentive payments will be distributed. Okay, next slide. Again, next steps, if you're a brand new entity for EQIP, email equip@crisphealth.org. That's what you need to do first. And then we will direct you to either complete the onboarding paperwork, or we will get you set up with your lead care partner in EQIP. For existing PY4 entities, your administrative proxies or lead care partners must log into the EQIP portal and start the enrollment process. Remember that you do need to sign into the CRISP HIE portal to gain access to the reports tab in order to reply. If you're having difficulties with this, please reach out to us immediately, and we will try to assist you through that process as quickly as possible. Any requests for NPI breakdown, if you need, if you want that list of what you are, volume, what you're eligible for ahead of time, please email us with your list of NPI participants at our email address at equip@crisphealth.org. Next slide. Again, if you have any other questions about the EQIP program, please email us directly at our EQIP address. And then we have a ton of different resources on our CRISP Learning website. This link right here will take you directly to the EQIP CRISP Learning website. And there's a wealth of information there. Before I end, is there any questions that I can help anybody with?
I do just have one thing to say for all my administrative proxies. We have gotten a couple emails just throughout the webinar that when there is currently a hold on adding administrative proxies through the Log Once portal since we are doing the whole migration. So if you do want to add new administrative proxies, you will have to do so on July 1st when you have that application open. So I just want to note that. So anyone who's submitted for a new admin proxy to be added, they won't be able to be added currently since the migration is still
I'm sorry, everyone. I'm not sure if you guys could hear me. I'm having difficulty suddenly with my internet. Kevin or Crystal, can you hear me?
Yeah,
Yeah,
you're
I can
coming
hear
I
you.
can
through.
hear you.
Okay, okay. I'm sorry. I couldn't hear anything. Crystal dropped off and I couldn't hear things. So at any rate, I apologize if I missed any questions or anything like that. Did we have any questions in the chat box, Crystal?
No, there are no questions in the chat box. I did see
All
someone
right.
with their hand up. I don't know if that was an accident or because it's gone now,
Well, if
but
you raised your hand, please come off mute and ask your question.
Just a quick addition, in case somebody is going to ask another question. There was one about the status for the care partner agreements that does display inside the care partner dashboard. So you can go in there and see that during the application.
Thank you, Alan.
Hmm?
Okay. Well, thank you guys for joining the webinar, and this recording and slide deck will be mailed out to you. It will also be posted on MedChi and EQIP's website. And we wish you good luck. Again, don't hesitate to reach out to equip@crisphealth.org if you have any issues or questions and need further assistance. Have a great day, everyone.